as I am every month. Thank you. And today is October 20th, 2022. If you're watching a recording of this webinar, be sure to check any information with cdc.gov or yimmunize.org because some of it might be out of date. We have a couple guest speakers today. We have Lonnie from DHS, if you want to give a wave. There's a wave from Lonnie. And we also have Patrick from Pfizer, who's going to be logging on shortly here. The FDA has asked all of the vaccine coalitions to start inviting the manufacturers for the COVID vaccines to do some really brief presentations about their products just to reduce some errors. So Patrick's going to talk about cap colors and all of that for just about 10 minutes, but the bulk of our time today will be with Lonnie from DHS. And I'm just realizing now, Lonnie, we have these like spooky slides. It's not because he's scary or ASIIS is scary. It's just because October is scary. And we're trying to be, with our holidays. So, and Patrick, I think it might be good to are you on already? It looks like.
I am. Hopefully you can hear me okay.
Yeah, we hear you great. So I'm going to stop sharing my screen now. And if you want to start sharing yours and just take it away. And if everybody can save your questions for at the end of Patrick or put them in the chat, we'll be sure that he gets them.
Okay. I'm starting to share right now.
And we see him great.
Okay, so they should be on full screen now. Thanks. So hello, everyone, and I'm really glad to be able to talk to you for a few minutes this afternoon. My name's Dr. Patrick Garman. I'm a PharmD PhD guy who lives in Arizona. I live out in Fountain Hills, and I work in Pfizer's medical affairs. And one of the things I get to do is go out and talk to healthcare providers such as yourselves. And I work in the vaccines division of our medical affairs. So I wanted to talk a few minutes today. I just have a few slides to talk about the bivalent COVID-19 vaccine, and of course, specifically about the Pfizer's mRNA bivalent vaccine. So that's what I'm going to talk about today. And it's really since the release of the two bivalent vaccines that are both EUA, right? The gray cap vaccine for 12 and above, and the orange cap vaccine for 5 to 11 years of age. And just to talk and go through some of this so you can actually see the labels, the label color, and we can talk a little bit about why the label colors are the same or very similar with the bivalent and versus the monovalent vaccine that we've been using. So first slide I wanted to pop up is just so you're looking through, we're talking about reducing the potential for vaccine errors. And I think there's probably a lot of nurses on the line. So you've seen this: right patient, right time, right documentation, right vaccine, right dose, and right route for the patient. So while I was doing my intro, that's why I had this slide up for you to look at. So I'm going to jump right in. We're going to talk about both vaccines. And I wanted to build on each vaccine. So to start out with, just some refresher, this is the gray cap vaccine, which, we have a monovalent, which is licensed, and that's 12 and above. So in immunocompetent individuals, remember it's the primary doses or dosing series is 2 doses separated by 21 days or 3 weeks in between. And that's for immunocompetent individuals. And for folks who have certain types of immunocompromise, it can be a 3-dose primary series. We get the first dose 3 weeks apart, the second dose, and then the third dose at least 28 days after the second dose. So now we've moved on to the bivalent vaccine. And I'll say this probably a few more times, but just understand the bivalent vaccine now is authorized, so it's an EUA, for a booster dose. The monovalent vaccine, gray cap, is no longer authorized for booster. It is only authorized for the primary series. So the booster now for 12 and above, again, is only the bivalent vaccine, and it's given at least 2 months after any previous COVID-19 vaccine. So whether it's an immunocompetent, you've had 2 doses in a primary series, and maybe you've had a booster or a second booster, still to get the bivalent booster, it's as long as it's been 2 months since a previous dose. So whether that's immunocompromised or immunocompetent or previous boosters, right? So that's the gray cap vaccine. And just so you can see, the labels are gray. And on the licensed vaccine, 12 and above, the monovalent, I guess is a better way to put it, is what you see on the left. It's gray around it. We put in a gray cap. We put the red here just to call your attention. The bivalent vaccine over to the right says bivalent. It says original and Omicron BA4 and BA5 for 12 and above. So I'll lay this out here now. We'll probably have some questions at the end, but just try to remember the FDA is working towards making the COVID vaccine program to be similar to our annual influenza vaccine program. So if you just think about what the influenza vaccine is, as far as an annual vaccine, and it's just one vaccine. In other words, there's not different, there is a high dose and a standard dose, but it's one vaccine in one color per manufacturer per year. So that's why the gray vaccine now, we're moving from the monovalent to the bivalent for this 12 and above. It's just in line with the influenza program as we head into the future. So that's why Pfizer, in collaboration with the FDA, has kept the gray cap color the same for the monovalent, and then the bivalent as we move forward. And it'll be gray into the future if the FDA asks and we update the vaccine into the future. It will continue to be the gray, and that will replace any previous versions of the vaccine. Hopefully that was clear. And then this is the final slide on the gray vaccine. I wanted to just show you that it's still the similarities between the monovalent vaccine and the bivalent vaccine. These are both do not dilute vaccines for 12 and above. So no dilution needed, and they're both 6 doses per vial. And of course, that dose is 0.3 mLs per dose that you pull up in a syringe. And that's for everybody 12 years and older. Now, if you look all the way to the right, then we put out here that there will be a single dose vial for the gray vaccine, for the bivalent, coming in the future. So that's pending, availability is determined by the US government or the FDA on when they would like us to be able to provide that single dose vials. And just so you know, as we head into 2023, from public comments, it appears that the federal government will stop purchasing and paying for the vaccine by the end of 2022. So just as a heads up, there's the potential commercialization of the vaccine probably as we enter into 2023. All right, so now we're going to switch over to the orange cap vaccine. So I say orange cap, and that's for the age group 5 years through 11 years of age. And again, this is just verbally to go over the different aspects of the vaccine. In other words, it is also a 2-dose primary series for those who are immunocompetent. However, this vaccine requires dilution, and after dilution, each dose is 0.2 mLs. The primary series for immunocompetent individuals in this age group is 3 weeks apart, so it's 2 doses, 3 weeks apart. For those that have some form of immunocompromise, you can add the 3rd dose to the primary series. So then you have day 0, so first dose, at least 21 days later, dose 2, and then at least 28 days later for dose 3. Now it's very similar to the gray cap vaccine for the bivalent vaccine. As I move to the right, it also is orange cap, orange label border, and it is authorized again for at least 2 months after either the completion of the primary vaccination with any authorized or approved monovalent COVID-19 vaccine, or the receipt of the most recent booster dose with any authorized or approved monovalent COVID-19 vaccine. And again, the monovalent vaccine is no longer authorized for booster doses. The monovalent vaccine is only authorized for the primary series. So the bivalent vaccine now is authorized for booster doses. And that's what I try to show on this slide, as well as to show you what the label looks like. So on the left is the monovalent label, an orange cap, 5 through 11, and it says 5 to less than 12 on the vial label on the left. And then the bivalent vaccine is on the right. And it both says, dilute prior to use, ages 5 through under 12. And on the right, then you have to look on the label in the upper right-hand corner of the label where it says bivalent. And it says original and Omicron BA4 and BA5 for the bivalent vaccine. Again, as we move forward, the bivalent vaccine is only authorized for booster doses and the monovalent is not. So as we move forward, you'll begin to pretty much use exclusively the bivalent vaccine. And again, it will tend to mimic the country's influenza program as we get through this year and again into next year, having a single product or a single vaccine for the influenza vaccine, or like the influenza vaccine, it will be for COVID-19. All right, and again, I think I already mentioned this, but the bivalent is for the booster dose only, and the monovalent is for the primary series only, and that's what this says. And after dilution, the orange cap vaccine it has 10 doses per vial, and it's again that's 1.3 mLs of normal saline used to dilute the vaccine, which results then in a 0.2 ml volume dose. And it has a 10 microgram dose in that 0.2 mLs. And if you remember, the gray cap vaccine has 30 micrograms in its dose. The orange cap is 10 micrograms. And then our maroon cap, which is for 6 months through 4 years of age, again, has 3 micrograms in it. So there is a dose escalation, whether you're from 4 months, it's 3 micrograms to 4 years of age, 10 micrograms, 5 to 11, and then 30 micrograms at 12 and above. All right, so this is an important slide. This is the storage options for all of the monovalent and bivalent vaccines from Pfizer. So you see gray, orange, and maroon with the different age categories there to the left. Now the storage conditions are on the right. So ultra low temperature freezer, which is ULT. So that's how the vaccines still come, and they're going to continue to come in ultra low temperature storage into the future. So that will not change. And then again, you can take them out of ULT freezer where they have a 12-month expiration date to the regular refrigerator of 2 to 8 degrees, and then you have 10 weeks when you move them into the regular refrigerator, 2 to 8 degrees Celsius. In red, it's very important to understand that there are no criteria or allowance for its storage, any of these vaccines, in a regular, I would call them a medical freezer or a standard freezer of -25 to -15 degrees Celsius. There's just no allowance for that temperature range. So you go from ultra low temperature, you can put them in a regular refrigerator, and then before use, you can take them out before the first puncture and leave them at 8 degrees Celsius up to 25 degrees Celsius. And 25 degrees is the standard definition for room temperature. And they can be left out before first puncture for 12 hours. And that includes any thaw time if they're frozen. And then again, you can use them for 12 hours after the first puncture. So again, you can take them out of the regular refrigerator or freezer before first puncture, 12 hours, after first puncture, an additional 12 hours. So that would add up to 24 hours total. Okay, so that's the storage of these vaccines. And then I wanted to put this website for everybody to look at up top where it says vaccine expiry website. Just understand a licensed vaccine. So the one that says Comirnaty on it, 12 and above, the monovalent vaccine, that's going to have the date of expiration on it. If it's an authorized vaccine, so it hasn't been licensed yet, it's authorized, an EUA vaccine, it has the date of manufacture on the label. And again, it's 12 months from the date of manufacture for the bivalent vaccine because it's EUA. If you have a licensed vaccine, it'll have the date of expiration, which again is going to be 12 months. So if you want to look up when the expiration dates are for a lot, you can go to our website, which is www.cvdvaccine.com. Has all the fact sheets there, or you can go up top where it says lot expiry.cvdvaccine.com, and that you can put in the lot number of any vial of vaccine, and it will come up with the expiration date for that vial. Okay. All right. So this is my last slide, and it's just to let you know that the EUA fact sheet for emergency use authorization vaccines are on our website at cvdvaccine.com, and there's each one. There's either for the EUA fact sheets, which you see now as the gray cap and the orange cap, and the bivalent vaccines, and then also the EUAs for the vaccines that are used for the primary series, the monovalent vaccines. So cvdvaccine.us.com. And then while I open up to any questions, I don't know if you've all had the opportunity to log into our training sessions, vaccine training sessions. The FDA and the CDC asked us to start these, and we started them actually voluntarily a long time ago when the vaccine first came out, and we still do them on a weekly basis, 3 days a week. So it's Tuesday, Wednesday, Thursdays. And if you go to this website at Pfizer Medical Information, you can click on, this will take you directly to it. But if you just go to Pfizer Medical Information, you can see the COVID vaccine training sessions, and it has a list of all of the training sessions, what days, times, and the link that you just click on. And those training sessions, these are only on COVID-19 vaccines. They usually last, up to 40, 45 minutes. They're updated daily. So if anything happens with the CDC or the ACIP, we update those trainings by the next day. And we put the updated information right at the beginning of the training. So if you've listened to the entire presentation before and all of the vaccines and storage, administration, and handling of them, and you just want to log in at the beginning to see if there's any changes, you can do that. Within the first 10 minutes, you'll see if there's any changes from the last time you attended the training. All right. So I can open it up for questions now. That's my last slide. Thank you very much.
Thanks, Patrick. And there is one in the chat. Is there a limit on how many boosters should be given?
Well, there's the recommendations now through the CDC. So right now, the recommendation is to get exposure to the Omicron variant, right? So that's why we have the bivalent vaccine, which has the original type of COVID-19 or SARS-CoV-2 in it, and then it's updated with the Omicron variant, BA4, BA5. So the important thing is if it's been 2 months or more since their previous COVID-19 immunization, as long as they've completed the primary series, right now the recommendation is for 1 booster dose with the bivalent. So regardless if you're on booster 1 or you had 2 boosters or you haven't had any boosters, as long as you've completed the primary series, the recommendation is right now 1 dose of the bivalent vaccine. Was that clear? I hope that answered your question.
Yeah, I think so. Anyone else have other questions? All right. Well, thank you very much. We are going to make sure that any other questions that you all have about the COVID-19 products, please let us know. We are, just like CDC and FDA are asking us to, going to be inviting folks on from the companies to make sure that you are all up to speed on caps and colors and schedules. We know it's all constantly changing. So thanks, Patrick. And if you continue to have questions, please just, chat them in. And Joe, did you have your hand up? Did somebody have their hand up? No? Okay. Maybe somebody clicked something different. So, all right. So we do have Dr. Nick Staub, our medical epidemiologist. Dr. Staub, are you on? I feel like we haven't heard from you in a while.
I'm here.
Do you want to talk with us about COVID boosters or anything else COVID that you want us to make sure that we know about?
Sure, and Macrina is on here as well, so I'll let her fill in anything I miss. But just to Patrick's following up on Patrick's presentation there, it's important to know that now everyone 5 years and older has the same recommendation for a booster. So I feel like for the first time in this COVID-19 vaccine response, things actually may have gotten simpler than more complex, but then Patrick started talking about cap colors and I lost it. But I think it's just, to the question that was asked, is there a limit on how many boosters someone can get? I think it's just really important to recognize that the recommendations for COVID boosters have now been, all the old ones were completely replaced with this new recommendation. So it's just a single bivalent booster for everyone 5 and older who has previously been vaccinated for COVID. So just ask, has it been 2 months? They say yes, and then make sure they get that bivalent booster. There is no recommendation for more than a single bivalent booster. And so that's everyone 5 years and older. Still really hoping to get some more kids 6 months to 4 years vaccinated, because our numbers are still low there. Keeping kids healthy and in daycare or in school this year is definitely our goal. The other thing I will add is a new announcement from FDA allowing for Novavax to be used in limited situations as a booster. So Novavax, when it was authorized only as a primary series, not to be used as a booster. It is now available for individuals 18 and older to be used as a booster if they cannot or will not receive an mRNA vaccine, the bivalent booster. So I don't know, we're not getting a whole lot of demand in our county vaccine clinics for Novavax, but if any of you are, know now that that can be used as a single booster dose. And I will pause there and just let Macrina jump in if she has anything else she wanted to add.
All I want to add is I'm going to go over a little bit. I think Pfizer, we've gotten enough on that. I'm going to go over Moderna because Moderna also has a bivalent booster for children 6 years and up. And so for 6 to 11, it's the bivalent. It's a dark blue cap with a gray label, and it is 0.25 mLs, and your 12 years and older booster is 0.5 mLs. Still need to use the monovalent vaccine for your primary series. I can't tell you how much I appreciate all of you that do this in your office, because it is an incredible feat, along with all the other vaccines you have to give. I recognize that COVID is not the only one you're out there administering. So I know it's a lot of work, and I really appreciate all that you're doing, because I now call the nurses in our clinic vaccine engineers, because when they go to the refrigerator to prep, it's a little complicated. And Rebecca, you want me to go over on the Ask the Expert real quick? We did.
Yeah.
Okay. We asked the expert regarding what happens if you inadvertently give a booster vaccine as part of the primary series. And so what you need to do is that if it is Pfizer and you accidentally give the bivalent booster as part of the primary series, there is no need to repeat the dose. You're just going to give that first dose, count it as number 1 in the series. You are going to appropriately enter it in ASIIS, and then you're going to fill out a VAERS report. If you do give Moderna as the primary series, you need to repeat that dose immediately, because it is a lower dosage, according to Ask the Expert.
Yeah. So that had come up on the last call, and I think whoever asked that, we emailed you separately the response that we got from CDC, but just to close the loop and make sure everybody knows.
Right. And
Pfizer repeat it for Moderna, or for Pfizer, it counts. For Moderna, repeat it.
And if you could send this out, I think this table here you got is going to be incredibly helpful. And please,
okay, yeah, we'll do that.
Fill out a VAERS form, because when you fill out a VAERS form, when something like this happens, it really does help them come up with information so that they can present it to everybody else. Let's everybody learn from everyone else's mistakes. That's really helpful. And again, everyone it's going to happen. The number one is to report it so that everyone can learn from it. And number two is come up with a process so it doesn't happen again.
Perfect.
And now I'm done.
Thank you. All right, so now Macrina's done. She talked about COVID boosters. She thanked you. We really are so appreciative that you are all sticking with your COVID-19 vaccination efforts. We are also really excited that Lonnie is here. And Lonnie, if you want to share your slides now, he is going to review everything we need to know about ASIIS, right? Or at least the common mistakes that you all make.
Yes, can you see my screen?
Yep, we see you.
Perfect. Yeah, so thank you for the introduction, Rebecca. My name is Lonnie Duffield. I'm a management analyst with ASIIS. And yeah, like she said, we're going to go through the some common mistakes as well as show off some of the updated platform. So we're going to go through the dose accountability cycle, and it's going to include all the screenshots from our new inventory management system, VOMS 2.0. If you're not familiar with VOMS and navigating the updated ASIIS platform, we do have lots and lots of user guides and training sessions that go into more detail. One of those is the dose accountability webinar. It goes a lot more in depth than we have time for today, and is held monthly. In addition, there are training videos that cover all aspects of ASIIS and VOMS. In addition, all the VOMS user guides are great reference material that are linked here on this slide, and I think in the chat. And they're always accessible on the ASIIS homepage as well. These are great to print out and just have next to you. I'll have some examples of how those can be useful throughout the presentation. Like I mentioned, we're going to go through the dose accountability cycle today and focus on some common mistakes within ASIIS. One way to look at it is the big picture of dose accountability is to see it as a cycle, and it's continuous. We'll start with reporting and accounting for doses and work our way through the cycle throughout the presentation. When you're shipped a vaccine and they arrive, they're going to go to one of three places. The vaccines are going in your inventory, they're given to a patient, or they're returned to the depot. None of those three options are just disappearing or just adjusting for them in the inventory without a real explanation. When you report administered doses to ASIIS, you can either record them manually / directly into ASIIS, where you log in, go to a patient record, add the dose, or you can record them in your electronic medical record EMR system and transfer the data to ASIIS via HL7. And then that will go directly to ASIIS. In order for doses to successfully transfer from an EMR into ASIIS, every one of the bullets shown on this slide has to match what's in ASIIS. It has to be correctly entered into your EMR, and then it has to be correctly mapped via HL7 to match the same fields in ASIIS. If even one of the elements does not match, the patient record will show the data, but ASIIS inventory won't decrement. So in VOMS, it'll stay the same. It'll stay the same inventory. If the doses don't decrement from the ASIIS inventory, it'll appear you still have those doses available to administer to patients within ASIIS. VFC is federally funded, and not every EMR and EHR uses the same wording, so be careful, but always choose the language that closest matches the federally required language. And another big thing with it is always match the box. So the manufacturer code, the MVX code from the box, and the lot number from the box is always what should be entered. You might see different details on the vials, but always enter directly from the actual box itself. There are a lot of inventory reporting requirements for COVID vaccines specifically. Within ASIIS, make sure that you're accounting and reporting every 24 hours within the administration of a dose. So anytime you're administering a dose, you're reporting within 24 hours. You're reporting to CDC Vaccine Fighter weekly, and your county surveys as required by your local jurisdiction. Like I mentioned earlier, always record the lot number from the box. It must always match what's in ASIIS. The vial may have a different lot number, the vial may have a different manufacturer, but always use the information that is from the box. If you use information from the vial instead, and it doesn't match what's in ASIIS, it's not going to decrement properly. So let's go through an example. On this slide, you can see the highlighted DTaP vaccine for 4L9E4. But let's say I don't have this in my refrigerator. I see it in my ASIIS inventory. This is what it looks like in VOMS. If you're not familiar with that, please, please, please go do those trainings that we have available for you. And so I want to check and see why it's here. And I'm certain that I gave it to VFC eligible patients. So to figure this out, I'm going to go through the troubleshooting process and see why these doses didn't decrement properly and how to go about fixing that inventory. First thing I want to do is run a couple different reports in ASIIS. One is going to be the lot usage and recall report. The purpose of that report is to show the doses that that decremented from the lot number. And then next, we're going to run the patient detail report. And that report is going to show all of the doses and even the ones that didn't decrement properly. And then we're going to compare that to actual dose accountability logs. If you don't have any of these dose accountability logs to track in person, they are available on azdhs.gov/VFC. And some EMRs might have a similar system built into it that you're using. Feel free to use the EMR system as well. Fortunately, the report module is all the same as it was prior to the implementation of VOMS. And so here we're going to navigate to the report section, report module, and then select lot usage and recall report. Once you've opened that report, this is what it's going to look like. So we're going to select the lot number that's in question. As you can see, I've highlighted at the top that DTaP for 4L9E4. And then I'm going to select add. That will drop it into the box below. And then at the very bottom, I will select create report. The report that's generated will look something like this. It might have a lot more information depending on how much data is in ASIIS for you. So if you look at the bottom of this page, if you look at the bottom of this page, it's going to be helpful because it'll show you the total patients on the report as well as the total vaccinations administered. You can notice on this report, there are 4 total patients and 5 total vaccinations administered. So if that's the case, you would want to look at the report to identify which patient received more than 1 vaccine in this lot and if that's actually valid. In some cases, some patients are administered the same vaccine and same lot number a month apart, and it's doses that they should have got. But in this scenario, we noticed Minnie Mouse got 2 doses of the same vaccine just a day apart. We may want to take a closer look to see if this scenario is valid. This makes you question, did she really come in 2 days back to back for the same vaccine, or was this entered incorrectly? This is where we would want to use an EMR report that is able to generate a list of patients who received a specific lot or our dose accountability logs to compare and determine, is this an actually valid administered vaccine? Here, this slide is showing a screenshot of the lot usage and recall report on the left and a screenshot of the filled out dose accountability log on the right. I'm going to compare both to see if I can identify any other issues. To start immediately, I noticed Minnie Mouse is on the lot usage and recall report twice. The report shows she received 2 doses of this DTaP vaccine just 1 day apart. But if you look on the accountability log on the right, she's only listed there once. This probably means she only got 1 dose and the incorrect dose should be removed from her record. Next, another example here, I can see on the dose accountability log to the right is that Buzz Lightyear and Briar Rose Aurora are both listed. However, if I look at my lot usage and recall report, those names are not on there at all. That could mean that Buzz Lightyear and Briar Rose got the DTaP vaccine, but it didn't decrement from the ASIIS inventory. So what can I do with all of this information? 1, I could go into ASIIS, check that Buzz Lightyear and Briar Rose Aurora are actually there in ASIIS as patients. 2, I would then want to make sure that the vaccine that was entered into both of their records is there. Then I would want to make sure that all of the information is correct. That could include funding source, manufacturer, VFC eligibility, vaccine code, facility ID, or the lot number, right? Any of that information. And then lastly, I would need to identify the discrepancy and correct it. So adding that patient, entering the vaccine if it wasn't entered at all, or just correcting one of those pieces that is incorrectly entered. Even though the lot usage and recall report helped me, maybe I still have doses in my ASIIS inventory that I don't have in person physically. So the next report I'm going to look at to troubleshoot that difference is the patient detail report. This report is able to show both doses that did and did not decrement. And if after looking at the lot usage and recall report, you find that you still don't have doses, that you still have doses that you don't in your refrigerator. So in ASIIS, you have doses, but you don't physically have them. You can pull the patient detail report, and it's very important you set this report up correctly to get all of the information that's helpful to us. It really is not helpful unless it is set up correctly. So you want to be careful with those details. Again, this report is accessed in the same reports module. So reports module, and then over on the right, patient detail report. This is how the patient detail report should be set up. You want to pay close attention to these details. But if you don't have to remember it from me, you can look at the job aid on our website and print it out from there, or you can use the course, refer to the course, How to Run a Patient Detail Report. And that's on that first IPO train link as well. So as we're going through this, the first thing you'll want to select at the very top is to run the report by service official vaccination record. By service is going to indicate that you want to see a list of all patients that you've provided service to, which in this case would be all patients who you've administered a vaccine to, regardless of who owns them in ASIIS. That way, if another practice has administered a vaccine or done anything to take ownership of that record, you'll still see the service you provided. For date range, we recommend you enter at most a month, maybe 2, and even smaller if your practice is has a lot of information. The report may time out as you're trying to run it, and if you're high volume, there's just so much information for it to sort through that it will take too long, even if it doesn't time out. For inactive status, you want to select both active and inactive for a similar reason to selecting by service, and so that patients may who are no longer with your practice but are still in ASIIS will show the vaccinations that you administered to them. For doses decremented, go ahead and select all. That way you're seeing both. And then you will then want to select either create report, which will open it right here in the browser, or you can select report, export report. Export is really great if you're comfortable with Excel, because then you can create the report and filter it by different columns in Excel. This slide shows a screenshot of the exported patient detail report. It's a little bit wonky here, but this is going to show both doses that did and did not decrement because we chose all on that last screen. The goal with looking at this patient detail report is to try to figure out why some of the doses decremented and some of the other doses didn't. So we can see all of the details that were submitted for each administered vaccine. So let's take a look at the manufacturer code or MVX code. You'll notice that the cells highlighted in yellow as have different issues. So the very first one, the main issue here at the bottom 2 are unknown, UNK, which you can see highlighted. It's lines 14 and 15, sort of in the middle here. If the manufacturer is missing from the record, it won't decrement from your inventory at all. Then up at the very top on line 2, you can see that the manufacturer code is NOV for this vaccine, so Novartis, but Novartis doesn't make this vaccine. This specific rotavirus vaccine is pentavalent, which means it was manufactured by Merck. So this manufacturer code should be MSD. So here, another scenario is if you select the incorrect manufacturer code, you can notice Varicella manufacturer code on line 12 has SKB, which is for GlaxoSmithKline, but Varicella is actually manufactured by Merck. So again, MSD, not SKB. So just by auditing this report, you can go into patient records and then go and correct the manufacturer code. So if you notice here, Aladdin, we could go back into Aladdin's profile and correct the manufacturer code. So now you may be asking yourself, okay, so how do I know what information is correct, what information I need to use, and where do I find that in VOMS 2.0? So in ASIIS, on the left-hand side, you can access the new inventory management system under inventory management and then clicking VOMS 2.0. Click the inventory tab there and then reconciliation. Identify the lot number you want to review and then select the lot history column. So once you've selected the correct lot that you want to check out, you can view the entire lot history, and that information is going to include order, transfer information, non-decremented patient records, decremented patient records, and reconciliation adjustments for the selected lot. Highlighted in red is a known issue with unknown health plan showing up. We're currently working with our vendor to rectify that, so just keep that in mind, that will be resolved. The second way of knowing what the manufacturer should be is using one of these handouts that we have located on our VFC resource web page that we talked about earlier. And you can also find it located on the ASIIS main page under valuable links. This handout includes manufacturer code, CPT code, and CBX code, which is all helpful for EMRs and HL7 data transfer, where data is being transferred into ASIIS automatically. This is also helpful to make sure all codes being transferred are correct. This resource could be printed, and then you can look at the manufacturer's name and compare to the patient detail report, like right next to each other, and see like, oh, that's why it didn't decrement. I have the manufacturer code listed incorrectly. Sometimes when you Google vaccine names, you can find more than one manufacturer associated with a vaccine, and we use the MVX code for the manufacturer. Here's some very common manufacturer errors. IDB, sometimes we see manufacturer code used with reported flu doses when it shouldn't be. IDB is commonly entered instead of SKB for GlaxoSmithKline. Another one is Novartis instead of Seqirus in GlaxoSmithKline. Wyeth instead of PFR or Pfizer. And then a lot of times we'll get other or unknown, which should not be entered for vaccines that you're actively administering. Those should only be used in the case of historical records. Now that we've reviewed the manufacturer codes, let's go back to the patient detail report. Let's say we've corrected all our manufacturer codes, so now we can look at the lot numbers instead of the manufacturer code line. One of the common ones here I have highlighted is S and 5 look similar. It's those first two that are highlighted. First glance, it looks like Daisy and Donald Duck's records are the same lot number, but one starts with an S and one starts with a 5. So that is probably why one lot or the other one didn't decrement. In the line below Daisy and Donald Duck, we see Flounder has quite a few 6s in their lot number. So it could be one too many or one too few was typed in. And that's why the dose didn't decrement from ASIIS inventory. A lot of errors we encounter are number errors or missing incorrect lot numbers. And anything that is not entered exactly correct will not decrement from ASIIS inventory. Here are a lot of the really, really common lot number errors. They include, like I said, all the letter ones, so 5s for S's, 2s for Z's, 4s for A's. But then also, if you're receiving multiple lots, so different lot numbers, but in a single shipment, a lot of times those are received incorrectly. So be really careful when you're receiving multiple lots in one shipment that you are separating those correctly by each lot number. Again, the trainings online go into that entire process in depth and give you a lot of examples in doing that. Another really common ones as you're entering things is, using, like I mentioned earlier, writing the lot number from the vial or the syringe instead of the box. Make sure you're always, always, always using the information that's listed on the box. Another common one is as you're looking at the box, parsing the wrong number. So be careful not to parse the NDC number as you're going through and use that. Make sure you're actually using the correct MVX number. Another one that's common is using the lot number from the diluent instead of the vaccine box. So just make sure it's the vaccine, not the diluent. So yeah, those are really, really common mistakes with lot number that catch you up. And the patient detail, this is the patient detail report in the VOMS 2.0 inventory shown. The lot number we're going to take a look at right now is the one circled in orange in VOMS. It's DB5H3, but the record we're reviewing on the patient detail report shows that the patient received the lot number DBSH3 instead of 5H3. Like, go back into the patient's record and correct the lot number so that it has a 5. This dose will decrement correctly from your inventory once you edit it on the patient record. Here's another example of how we can compare the patient detail report with the VOMS 2.0 inventory. In this example, VOMS shows the Pediarix, the DTaP Hep B IPV. But in the patient detail report, it shows a DTaP IPV, which is a Kenrix vaccine, was administered. So it's the same lot number, but the actual name or type of vaccine was changed here, right? So if this patient really got this lot number, then they would have received Pediarix and not Kenrix. And so that's why in this scenario, the last dose did not decrement. It would be helpful to have a dose accountability log or see your another EMR EHR report so that we can actually see what vaccine the patient got that day. Did they get the Pediarix or did they get the Kenrix? And is this the right lot number or is it the right vaccine name, right? So those are kind of the things that you'd want to investigate. We could also look at the funding source in the VFC eligibility columns on the patient detail report to identify a potential dose accountability issue. All VFC patients must be screened for eligibility at every visit, and this information must be documented accurately in their record. The point we want to really stress here, some of the common vaccine name errors, but one of the point we want to stress with these two reports is that they're there to help you find errors, correct them, and then most importantly, prevent making those errors in the future by changing your clinic processes, training your staff differently. We strongly encourage the use of dose accountability logs if your EMR doesn't track that information itself, or if you don't use an EMR at all. So the goal is, again, find your patterns. If you see the same person making the same mistake, or it's always the same mistake being made throughout the practice, you can change your clinic's processes to avoid these errors. Yeah, and like I mentioned before, unspecified formula is meant to be used for historical doses only and shouldn't be used for current vaccines that you're actively giving. Next step in the dose accountability cycle is reconciliation. The first part was the longest, I promise. But once we fixed any administration errors, record errors, then we'll go into ASIIS and reconcile our inventory. We're going to assume that you've entered your doses, your administered doses in ASIIS, done the troubleshooting steps to account for doses that didn't decrement already. To reconcile your inventory, it's within VOMS, and we're going to click into inventory and then select reconciliation. Once you're at the reconciliation page, you'll click print at the top right to open a printable reconciliation worksheet for your inventory, and then you'll click print at the top right of that worksheet to actually print that information. Here's an example of what the reconciliation sheet will look like. It's really, really helpful because you can take it with you to your fridge, your freezer, and compare directly what's in VOMS as listed and what's actually in your physical inventory. Don't be super alarmed if it doesn't match exactly what's in VOMS 2.0, especially if you're using an EMR. Sometimes those EMRs do take some time to transfer over to ASIIS. So let's look at an example of how to use this worksheet. Let's say that in VOMS 2.0, you have 10 doses of a specific DTaP lot, but in your fridge, you're only counting 9 doses of that lot. If you remember that you gave a dose earlier that day, it's a really safe assumption that you're just waiting on the EMR data to transfer. We'd recommend checking this again in 48 hours and just make sure that that dose did decrement. And if for some reason it hadn't, obviously, you would need to do some of the earlier troubleshooting steps to see why. But let's say you have a lot in Hep A in your ASIIS inventory that shows you have 20 doses, and you know that you administered all of those 20 doses months ago, and they're still showing up in your ASIIS inventory. That's a red flag, and the administration data should have transferred by now. So this would be an example of where we would go back to our troubleshooting steps and run some reports. As a reminder, you're required to reconcile your inventory before you order vaccines in VOMS 2.0. So again, take inventory using the VOMS reconciliation worksheet. Look for any red flags like the 20 doses, and then use critical thinking just to figure out whether the EMR data hasn't transferred yet or whether there are doses you still need to account for in ASIIS. You'll also want to take into account that if you have lot numbers from months ago that you haven't used, you may be ordering more than you should be, and you'll want to figure out how many doses you need to order and how often you need to order them. So that might mean ordering fewer doses on a more frequent basis. If you have a lot number with a 0 quantity to inactivate, go ahead and click the inactivate button on the right-hand side and then save at the bottom of the page. Important note here is to not actually try entering the number 0 when you're inactivating it. It will mess you up. And if you're trying to do all of your reconciliation, which at a lot of times you are, and you've typed in 0 and you've gone through all this work, now you have to go through your whole inventory again, delete out those zeros, mark those inactive. So just be really careful. And if you're not familiar with that process, please, please, please make use of the trainings that we have available for everybody. It goes through that whole process. In the screenshot, I want you to notice that the lots highlighted in red in the VOMS 2.0 inventory, any lot highlighted in red in the inventory is a lot that has expired. If the expired lot has 0 doses under the quantity on hand, that means I can inactivate it by just clicking the inactivate box on that lot number line, saving, and you're good, right? So let's go through all the expired lots in this screenshot and determine which ones can be inactivated right away. So the very bottom red lot for 42 RC4, you'll notice quantity on hand has 50. So I can't just mark inactive. And like I just mentioned, I can't just type 0 and then mark inactive. So that's not the process for it. You would want to click 0, save, and then you'd be able to go back through and actually inactivate it. Again, if you guys are running into issues with this process, please, please, please use those training guides. It goes through them step by step. And so I would suggest using that because it can go into a lot more detail with a lot more time than I have today. So now let's jump ahead a few steps. You've gone and submitted the wasted expired form. You've received the email from our office confirming the form was processed, received the shipping label, etc., and you have mailed the expired doses back. Now you'll need to reconcile your inventory in VOMS, and in the reconcile inventory page, enter the physical count in the corresponding box. This number will be the number of doses you have remaining in your cold storage unit after returning all of your expired doses. Since you're changing the quantity to remove the expired doses, you'll then click on Adjust to pull up the Adjust Quantity box. And in the Adjust Quantity box, you'll enter the number of doses being removed. Then you select the appropriate adjustment category from the drop-down menu. If there's another adjustment reason, click Add Another Reason. Repeat the same process until all of the doses in the top right corner are off and it says 0. When the total doses off is 0, you can click Save. Additionally, expired COVID-19 vaccines do not currently need to be mailed back, just as a disclaimer. Sometimes you'll need to reconcile your inventory because just one dose was wasted. An example of this scenario is here dropped 1 PPSV dose on the floor right before I was going to administer it, and it broke. What would I do? You'd submit the wasted expired return form to IPO, marking the 1 dose of PPSV 23 as wasted. Then in ASIIS, I would find the lot in my reconciliation to adjust it correctly. And then in this screenshot, you can see the PPSV lot in question shows 10 broke. Since only 1 broke, -1 would be my adjustment, which means the physical count I would need to enter 9, as I still have 9 doses in my cold storage unit. When making adjustments, the physical count should always be the quantity on hand plus or minus the adjustment column. Additionally, I'll not inactivate this lot because there's still 9 doses to be administered. If you need further help with dose reconciliation, we do again have a job aid for that on the VFC page, azdhs.gov/VFC. Additionally, we do have a resource on our VFC resources page to help you track vaccine wastage. The vaccine wastage tracking log is useful if there are a lot of staff administering vaccines all day, because if something happens to a dose, they're able to quickly jot down that information for everyone else. And then the primary or backup coordinator could then use the report and mark down all wasted doses on the wasted expired form. If you're noticing a lot of doses are being reported on this log, you may want to revisit your workflow a little bit. Before I go on, I do want to mention with the reconciliation step, there are some things that are being ironed out in that process. I'm seeing a lot of questions come up with that. So there's just currently we're discussing permission issues, but really with the VOMS 2.0 change, if you do have more questions, please use that training and reach out to ASIIS Help Desk as necessary. While we don't go through go ahead.
Lonnie, do you know, there's a discussion around whether VOMS lets you remove zeros anymore. Do you know that? It sounds like some people are calling ASIIS and hearing that they need to call ASIIS every time.
So it's not, I please send me go ahead and send the details for that. Or if you have like that lot number or information, please like send that to ASIIS Help Desk. You should be able to zero out your lots if that's the question, and you can, once they're zeroed out, inactivate them. Those just can't be done in the same step. So you can't inactivate a lot that is marked with physical as 9, even though you know it has 0. You have to save that as 0 first. Once that step is done, you can inactivate the zeroed out lot. Again, please just,
Does that help, Jen or Rosemary?
Yeah, no, I saw some of those coming in. The training guide that we have on IPO Train goes through all of that process, like start to finish, and it should work if you follow that workflow. If that workflow doesn't work for your office, we need that information so that we can, try and figure out the workaround for you individually. And at that point, you would reach out to ASIIS Help Desk. Cool. One of the things that I wanted to touch on before we closed up for today, because we're running out of time, is Smarty Streets. This is a small feature upgrade that's coming soon to ASIIS, and it's going to help a lot with data integrity. It uses standard formatting for addresses as you add them into ASIIS. So this will be available in the different areas that contain address fields, and it's a pop-up, and as it pops up, you can simply click Use Smarty Address, and it'll use the standardized address it finds. Or you can click Keep My Own, and it will override that. It's not live yet, but it's going to be a feature that's released in the new future upgrade, Sorry, I'm pulling up chat and kind of going through that too. Yes, so there is a difference between reconciliation and inventory management, and I think that's one of the big differences is that there. So again, we're working on some workflow differences for the permissions when it comes to inventory management, reconciliation. That entire process that is laid out in our training will allow you to inactivate those zero out and inactivate lots if you follow the steps that are there. But it's in a different place than inventory management. It's in reconciliation. So you want to make sure that that's where you're going. But yeah. That is what I have for today. Thank you. And again, here's the email. If you don't have that for some reason, ASIISHelpDesk@azdhs.gov. And yeah, please reach out. And again, if you are running into these issues, we are trying to iron them out. VOMS was a huge change, so we want to make sure everybody has the proper workflow and can get vaccines administered and everything managed correctly.
Great. I know we only have 1 more minute left, but we could keep the line open for a little bit after, just in case that you have questions that are kind of global that maybe Lonnie can answer. And if there's anything really specific, Lonnie's here and can write down your email, your name and your email address, and make sure that you get hooked up with the right person.
Yeah.
So.
And with those issues, please, if they are specific, we need the specific details with them. So whenever you're talking about, oh, I can't zero out a lot, we need an example to work through so that we can replicate exactly what you're going through. So please provide the lot number, all of the information that you're trying to work with.
Great. So I will, if it's okay, we'll keep the line open for just a couple more